All right, so we know colon cancer screening saves lives. A new study reveals that many patients are still paying out of pocket for preparations needed for colonoscopies, despite a federal law that says they should be covered by their insurance. Colon Cancer Coalition President Chris Evans is here to explain. Chris, thank you for joining us. What did that study find?
Well, the study found that patients did not know they had a choice in PrEP, that they really dreaded PrEP, and that they were paying a lot of cost sharing or out-of-pocket costs for the PrEP.
What does this mean for people who need the screening of a colonoscopy?
Well, what we want to do is we want to get this so that patients go get the colonoscopy, and tolerating the PrEP is a big part of it. And also there are cost considerations. So we want to make sure that patients know their choices and know the costs that face them with those choices, and so that they follow through with the screening.
Let's start kind of from the beginning. I'm always a guy that's like, let's educate the people just in case they don't know. What are the processes with the colonoscopy, and why should we not be afraid to get this done? I know it's dreaded, but why do we need to do it?
We need to do it because it is a screening test that actually prevents cancer. They go in, they look, they see the colon wall, they can find the precancerous polyps and remove them. And so it actually, you don't get the cancer that way. And if there is cancer, you catch it at a very early stage and you have less lifetime impact to, your quality of life. So it's a very, very important and unique test in the cancer world.
All right, now that we just convinced everyone watching to go get a colonoscopy, how can your organization help us to make sure that our insurance is there so that we don't find ourselves paying kind of how this study's out there?
Well, we're working nationally to try to make sure that all the PrEP options are covered. But for you as an individual patient, you just need to talk to your provider and talk about what those choices look like. Is it a 4-liter that you drink? Is it an over-the-counter? Is it pills? Is it a low volume? There's a new one that came out that tastes really kind of good. So, what is it that you can tolerate as a patient so that you will continue to get colonoscopies, even for the second and third colonoscopy if you need it? So it's important that you talk about your choices and the costs and that are associated with those choices at this moment.
I think you hit on it. I think some people think when they go to the doctor, they just have to take the first suggestion instead of like, let's explore all these different things, ask questions, Google, do your own thing. Why is it important that we really lean in instead of just taking one opinion?
Well, I educated patient, I think, is a new thing that we're a pretty sophisticated group of people coming up, right? And I think you educate yourself what's best for you. I just told my friend, hey, if I would have known there were pills to take instead of drinking a high volume liquid, that's what I would have done. Know the difference between the quality of the PrEP of an over-the-counter versus a prescription PrEP. And we have a lot of that information on our website, but you can also you can research yourself or ask your doctor, but just don't take that first, the first suggestion. Let's put it that way. You're right. We do that.
I like it. Thank you so much for joining us, folks. Make sure you check out the Colon Cancer Coalition for more information.